Hello ladies and gents, it's me again, it's Fee, hello. So I just wanted to use this video to discuss something that I'm getting quite a lot of comments and emails about, this kind of flowchart process, whatever the NHS use, gynecologists use to enable them to go through almost like a tick list. I'm really sorry. The answer is I don't know what it's called. I would recommend going and speaking to your GP, or if you have a gynaecologist, going and chatting to them about it. It is absolutely there for any woman who is suffering with gynecological problems. They need to go through this kind of step by step. Tick you off. Yes, that works. No, that doesn't work. Okay, let's move on to the next thing. For me and my journey, it was the mini pill, which didn't work very well with me. We then moved on to the tranexamic acid and the metforminic acid. I still don't know. I swear to God, by the end of the videos, I'll know how to pronounce that one, okay? But basically the two acids, so the anti-inflammatory acid and the clotting acid, you would absolutely be given those if you are bleeding too much during your periods. The next one will be the Mirena coil. Again, if you're bleeding too much or if you're having hormone related problems because of your cycle. Again, it's all very, very much depending on who you talk to as to what information you'll get about how it will impact you. So as I said in my previous video, when I spoke to my GP, he was adamant that the level of hormone release from the Mirena coil will have no impact on my mood. I knew differently. When I spoke to my consultant, my surgeon, who is a gynaecologist, he went straight away, he said, Mirena coil. Absolutely, Mirena coil. It will impact your mood. So, yeah, again, I think we have to give GPs their due. They are general practitioners. They know a little bit about a lot of stuff, so they don't specialise unless you get a GP who has specialist knowledge with hormones or gynecological problems. You know, I think what really is important through all of the process, I'm really sorry, I think something's just thrown in my eye, is that you listen to your body. Actually stop, get off your hamster wheel of whatever it is you're doing. What's your body trying to tell you? And for me, I recognised so quickly that the coil was having such a negative impact on me. I just published my first book. I remember having my book launch, which we actually had to do in my therapy room because we were still in the midst of COVID. And I should have been so excited. But I wasn't. But I wasn't sad. I wasn't depressed. I was just like, it's another day, isn't it? And that's wrong. That is absolutely wrong. That is not how I should have been. So we've gone through the mini pill, the 2 lots of acid, and I will say, yes, the medication helps. It does help. But it got to the point where I think I became intolerant to the medication and it didn't work towards the end of my journey. So yes, if you haven't got the acids, go and get them. They are amazing. And with the support of my gynecological surgeon, because Mr. Thompson is a gynecologist, we were able to tweak the dosage of those meds. So I actually took more than what I was prescribed from the GP, just for the few months before my operation. We then took the Mirena coil. Not pleasant to have that put in. Not at all pleasant, and don't let them tell you any different, okay? It is not like having a smear. It is, the very first part is like having a smear in terms of that weird thing that they put in and then they open it up. I don't know what it's called. But then you do have pain, so I would highly recommend, if you're going to have the coil, take some painkillers about half an hour before you go, because you will need them. I felt internally uncomfortable for quite a few days after the coil had been inserted. I can't say that I could say I felt it. I just felt uncomfortable. And then obviously, so I was in March, April, May. 7 months I had mine in. And when they took it out, it was hilarious. So I was lying on the couch in the doctor's room and she says, "Oh, you haven't had your smear test. I'll do that while I'm here as well. And you know, when you're like, anything else you want to do, feel free, line up, help yourself." So I had my coil removed, and then I had, in fact, I think it was the other way around. I think I had a smear, then they took the coil out. Smear was fine. But I would say within a week of the coil being removed, I felt better. So I knew that was right. That was the right thing to do. So I'm sure there are lots of other possible avenues that someone could take on the flowchart. That is my avenue. That was my path leading me to my potential end destination, which I knew with the removal of the coil would be some form of surgery. Now, the surgery we'll talk about in another video, but yeah, I knew that was my last chance, and I was genuinely disheartened and very sad when it had to be taken out, because I knew the possibility of what it could have done for me. And I think when I look back, I think it was working. The level of bleeding was slowing, and it wasn't great, but it was better than it had been. So perhaps if it had been longer, it would have got better. I don't for a second, and I think I said that in my previous video, I don't for a second think that it would have stopped the periods at all. They were so massive. So no, I never thought for a second the Marina coil would stop my periods, but it certainly was starting to slow them. So really, back to the point of the video, the process, the flowchart, whatever you want to call it, that women have to go through this series of interventions before they can get anywhere near having, surgical intervention. And I'm not just talking on the NHS. If you want to pay and go privately and have a hysterectomy, the very first thing the gynaecologist will say to you is, what intervention have you had? Because you need to do this, 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 and this before you can have the hysterectomy. And one of those things is you have to have had the coil, and you have to have had a 6 month clear span of having the coil removed before they will operate on you. That's some useful information or useless information. Yeah, go and ask the GP. Go and ask. Maybe you can even use the all-knowing oracle that is Google. It'll probably tell you, but it is definitely there for you to read, and hopefully going through the process. For me, I'm quite a logical person. I quite like being organised and in that kind of administrative process that I can tick off, yeah, no, that didn't work, yeah, no, that didn't work, okay, we're going down this way, and finally we end up at the bottom, and that'll tell you where you need to be. Now, don't forget, if you liked this video or any of the previous videos, hit like, and if you want YouTube to nudge you in the fizzog when I release a new video, don't forget to hit subscribe. Thank you so much, and I'll see you soon. Bye.